Good evening and welcome here. Throughout the semester, we have been researching the topic of cardiovascular disease and how it relates to the 9 body systems, which is on our website, which will be shown later on tonight. As you have all been able to tell, each group has been focusing on a different area to divide this wide range topic. Tonight, my group and I will be talking about the risk factors or causes for cardiovascular disease, 2 individual types, and how to treat or care for each one. Near the end of our presentation, we'll have a little activity involving the little heart-shaped papers we have handed out to some of you. But before we begin, I would like to introduce the girls I was so privileged to work with during the semester. Here we have Anna Gruen, Tabea Eisner, Diana Friesen, and I'm Chloe Trieger.
There are many different types of causes, but tonight I will be mainly focusing on how smoking, age, and gender can be causes of CVD. Smoking increases the risk of developing a CVD, which includes heart attack, coronary, and a stroke. Smoking damages the lining of the arteries, leading to buildup fatty material, which then narrows the artery and that can cause a heart attack or a stroke. Gender, as you get older, your blood vessels also get older. You get less flexible, which makes it harder for the blood to flow smoothly. Fatty deposits, also called plaques, build up in years along the artery lining, which also slows down the blood flow. Gender, for many years it was considered a men's disease. Now it's known for heart disease. Now it is known that heart disease is also a leading cause of death for both women and men. Men tend to develop a heart disease earlier than women, but after the age of 65, heart disease is almost as common is as common in women as in men.
Okay, so I will be talking through some types of the cardiovascular disease. There's a heart valve disease, heart failure, hypertension, heart attack, and the main ones that we will be focusing on are congenital heart defect and cardiac arrest. There are so many more different types. So, cardiac arrest is a temporary or permanent cessation of heartbeat when your heart suddenly stops beating and can't move blood effectively. So the first one is coronary heart disease. This type of heart disease begins in the coronary arteries. Arteries supply the heart muscle itself. When they become, your heart won't receive the blood it's supposed to and will stop working properly. Large heart. This type of heart does not beat correctly. Muscle also be prone to lots of damage. Irregular heart valves. Valve disease can make heart valves leaky or narrower. Blood circulating through the heart either overloads the chambers with blood or does not fill the capacity. Chambers may become weakened or enlarged. And electrical impulse problems. Problems with your heart's electrical system can increase your risk of sudden cardiac death. These problems are known as primary heart rhythm abnormalities. Some side effects that you can get are high blood pressure, obesity, substance abuse, family history of heart disease, low on magnesium or potassium. So in this image, it explains the normal heartbeat on the left side and the blood flow, and on the right shows you the reaction of the sudden cardiac arrest. And the circles are the origin of arrhythmia. Arrhythmia is a condition in which our heart beats with an irregular or abnormal rhythm. And living with cardiac arrest. Living with the condition is a long-term physiological care of cardiac arrest survivors. This is a relatively new area of study. Significant advances have been made in this field for the last year/decade. Near-death experiences appear to have a long-term protective physiological effect, even though many studies have shown a significant proportion of cardiac arrest will have behavioral cognitive disturbances that may begin soon after the cardiac arrest for many years. Impacts on life. This is widely recognized that can cause severe mental reactions. This is a very stressful event. Many have survived, but they are left with a degree of brain injury, moderate to severe neurological sequelae being found in approximately 50% of cardiac arrest after a year. And some facts. Second leading cause in Canada. They're 3 times higher among adults aged 20 and over, and men are 2 times more likely to get it than women.
Okay, I will be doing the treatments for cardiac arrest. The first response treatments would be CPR or defibrillation. Then once the patient reaches the hospital, one of the things that could be done is angioplasty. Angioplasty is an endovascular procedure to widen narrowed or obstructed arteries or veins. This is an artery that's built up with lots of cholesterol that's blocking the blood flow. Then the stent with balloon is inserted, and then the balloon is inflated, then the balloon gets removed, and the stent stays in there. People who undergo angioplasty immediately after cardiac arrest have better survival rates compared to those who don't. Another thing that will be given to you is antiarrhythmic medications, and that's a group of pharmaceuticals that are used to suppress abnormal rhythms of the heart. Then there's heart surgery, which is a surgical procedure to restore normal blood flow to an obstructed coronary artery. Surgeons will use a healthy blood vessel from another part of your body to create an alternate route or bypass around narrowed or blocked sections of your coronary arteries. And then there's implantable heart devices, or in this case, an implanted cardioverter defibrillator, and it's implanted right under the skin and just under the collarbone. Some of the complications associated with cardiac arrest can be prevented with the use of these certain devices.
Alright, so congenital heart defect. Congenital heart defect is a problem with the heart structure that is present at birth. It also changes the normal flow of blood throughout the heart. Defects can involve the walls of the heart, valves in the heart, veins and arteries close to the heart. There are some cases where congenital heart defect doesn't show any symptoms at all, which means newborns won't get diagnosed until they're children or even older. This may not be a bad thing, as people will just live on their lives not knowing they have this condition. But on the other hand, if people don't know that they have this condition, they can experience a major symptom such as a heart attack. The 2 types of defects I'll be talking about are atrial septal defect and ventricle septal defect. So here in figure A, it shows the structure and blood flow of a normal beating heart. The blue arrow shows the flow of oxygen-poor blood pumping through the body to the right atrium, then into the right ventricle, through the pulmonary artery, and then to the lungs. The red arrow represents the flow of oxygen-rich blood, which flows from the lungs through the pulmonary veins to the left atrium. But now here, figure B, the hole shown, that area, allows oxygen-rich blood from the left atrium to mix with the oxygen-poor blood from the right atrium. And with the purple arrow, it shows the 2 blood types mixing together. Now, ventricle septal defect, in figure A, it shows the exact same picture. So it's the blood flow of a normal beating heart. But here in figure B, it shows 2 common places for a ventricle septal defect to be placed. The holes allow oxygen-rich blood from the left ventricle to mix with oxygen-poor from the right ventricle before blood flows into the pulmonary artery shown by the purple arrow. Now, with both defects, they both affect the amount of physical activity you can take in a day. The blood from the left side is oxygenated and the blood from the right side is deoxygenated. And when these 2 mix, we no longer have a clear oxygenated side and a deoxygenated side. This isn't a good thing, because if the oxygenated blood gets diluted with deoxygenated blood, the cells won't be able to grow normally, which isn't good for our circulatory system and can become hard to breathe. CHD doesn't really affect the people who have it, as they've had it their whole lives and they don't know what it's like to have a normal heart. Women get more impacted because they carry the babies. But women with repair defects can have a safe pregnancy with little risk. But women who don't know that they have a condition with their heart will soon realize during the second and third trimester as symptoms will be shown. If a woman does have a defective heart, their baby still can have a healthy heart, but to be sure, there's an ultrasound called the fetal echocardiogram, which checks the baby's heart for any defects before they're born, and this can be tested during the 18th week of your pregnancy. CHD can cause problems in your kids' and babies' growth by them not gaining weight as quickly as other infants would. But with medical technology improving, newborns and children are living longer and healthier lives than ever before. Now they are able to move into adulthood. With ongoing medical care, it can help children and adults with CHD live as healthy as possible.
How is congenital heart defect treated? The treatment for congenital heart defect depends on the type and severity of the defect. Some people have mild heart defects and have healed on their own over time. Others have more severe defects that require more treatment. Medication. There are various medications that can help the heart work more efficiently. Some can also be used to prevent blood from clotting or to control irregular heartbeat. What kinds of meds are there? It is different on the age and on the person, but though it is usually found in infants, these are some of the examples that are used to treat congenital heart defect. Antiplatelets and bosentan, and the implanted heart device is also a technique, but it's the one today. I explained it before. Another procedure is the catheter procedure. It allows doctors to repair certain congenital heart defects without surgically opening the chest or heart. During this procedure, the doctor will insert a thin tube into a vein in a leg and guide it up to the heart. Open heart surgery is done if the catheter procedure isn't an option. A surgeon may perform open heart surgery to close holes in the heart, repair blood vessels, or widen them. The last option for this treatment would be to do a heart transplant. During this procedure, the patient's heart is replaced with a healthy heart from a donor.
Okay, that will lead us to the end of the information in our presentation. Now you guys all got those heart cards. That's for part of our game. The game works. I will ask the first question, and the person that has the answer to that question will read it out, and then they will have a question to that answer, and the person who has the answer to that will answer and read the question, and so on. The first question is, what are the main 3 causes of CVD that we talked about in our presentation?
Does anybody just answer?
Yeah, whoever has the answer to that on their card. One of them would be smoking.
Is it smoking, age, and gender?
Yeah.
Who has the 2 main types of CVD that we focus on?
I have congenital heart defect and cardiac arrest. What is the definition of cardiac arrest?
I have the definition of cardiac arrest. It's when your heart suddenly stops beating and it can't move blood effectively. Who has one of the 4 symptoms of cardiac arrest?
Who has the definition of large heart?
I have the definition of a large heart is a type of heart that doesn't beat correctly and muscle and beat both damage. Who is the first to respond? Who is the 2 first response treatments for cardiac arrest?
That's me. So I have CPR and defibrillation. Who has one of the treatments for cardiac
cardiac arrest once the patient reaches a hospital.
Just guess.
Oh, that's not a good idea. Angioplasty?
Yeah.
Oh, sweet. I have angioplasty. Who has the definition of it?
I have the definition of angioplasty. It's an endovascular procedure to widen the aorta or obstruct the artery. Who has a problem with congenital heart defect?
Oh, that's me. I can that word heart defect and that's it. It's scribbled out the rest.
The question got scribbled out.
That's it.
So that brings us to the end of our presentation. We hope you all learned something from it, or at least enjoyed it. We'd like to give a special thanks to our biology teacher, Mr. Tim Weeb, for helping us throughout the semester with our presentation, as well as Dr. Sherwin Gakatan, Madeline Stephen Bauer, for coming to our classroom and giving us a better understanding about the topic. And we have one last thank you to give out, and that is to our special guest, my uncle, Dr. Kurt Kamphofen, for coming out tonight. For more information about cardiac arrest, congenital heart defect, and CVD with the relation to the 9 body systems, visit our website at www.riskfactorsandtreatmentsforcvd.waverly.com. Thanks for everyone for coming out, and we hope you enjoyed the rest of the presentations.